Hello everyone. So today in MBK's quick bites video session we'll be starting a very important topic, that is hypertrophic obstructive cardiomyopathy. This is a highly important internal medicine topic and it should be compared with aortic stenosis for certain reason. We'll be seeing that anyway. So hypertrophic obstructive cardiomyopathy means let's take this as a shape of heart. Just for instance, the muscles of the heart would get hypertrophied. This is because of a genetic reason. So usually the reason it is an autosomal dominant disorder, and this is because of beta myosin or C protein mutation. In these genes, beta myosin or C protein mutation is the cause for hypertrophic obstructive cardiomyopathy. So it's an autosomal dominant disorder. So we will see the key features of Hocm. So to remember all the key features, I have made a mnemonic, that is A, B, C and rule of S. So to start with A stands for autosomal dominant. A stands for large A wave, a JVP waveform, large A wave. A stands for apex beat. Apex beat will be doubled. So doubled apex beat, large A wave and autosomal dominant. So these 3 points are important for the word A, the letter A. And then talking about B and C, there are 2 points I would like to say in B and C. We have already seen here B and C is beta myosin and C protein mutation. That is the first B and C. So I just gonna put a word mutation. Okay, of beta myosin and C protein. The second B and C that you need to know is beta blocker and calcium channel blocker. So that is B and C, beta blocker and calcium channel blocker. This is the first line drug of choice, first line treatment, or beta blockers and calcium channel blockers. Beta blockers commonly used is propranolol. I put a P, propranolol. Calcium channel commonly used is verapamil. I just put a V. Propranolol and verapamil. These 2 drugs you must know. Then coming to the rule of S. There are a lot of S that you need to know. Number 1, it occurs in younger patients. So I just put small age. Small age. So that is young patients. Number 2 is systolic blood pressure is altered, so abnormal systolic blood pressure. The third point is patient will have systolic murmur. Systolic murmur, usually a ejection systolic murmur. That's the third point. And the next S you must know is squatting. If the patient squats, the murmur will decrease. Squatting reduces the murmur, intensity of the murmur, decreases the murmur. If you do an echo, you will see septal wall thickness. So septal wall is thick. Okay, usually more than 3 centimeters. Septal wall is thick in echo. And the last S you must know is there's a syncope. There's going to be a shortness of breath, and there's going to be a suffering heart. Suffering heart means angina. So all of them are during exertion. So exertional syncope, shortness of breath, and suffering heart, that is angina. Now, I initially told that Hocm should be compared with aortic stenosis. The reason is similar presentation of syncope, shortness of breath, and angina during exertion can be seen in aortic stenosis also. So in Hocm and also aortic stenosis, same presentation is seen. So all you need to know is, in Hocm there is a chance for sudden cardiac death. In aortic stenosis there is not there. That is the major differentiation that you need to know. Sudden cardiac death. Another differentiation point that you need to know is, I have already told, in Hocm squatting reduces the murmur, but in aortic stenosis squatting increases the murmur. You need not memorize it for aortic stenosis. Squatting increasing murmur is common for most of the murmurs. There's only two exceptions. One we have seen already, Hocm, Hocm. The another exception is mitral valve prolapse. Squatting reducing the murmur is also seen in mitral valve prolapse. So that point also you need to know. That is also very important MCQ. So in our list of S, we'll be adding one more point in Hocm, that is sudden cardiac death. I hope these points are very, very clear in Hocm and aortic stenosis. So now we will see the comparison point of Hocm and aortic stenosis here. Few important points alone we will see. Hocm versus aortic stenosis. Both of them commonly have ejection systolic murmur. So that is common for both. Both of them commonly have exertional symptoms. Both of them. Hocm, sudden cardiac death is seen. Aortic stenosis, that is not there. In Hocm, squatting will reduce the murmur. In aortic stenosis, squatting will increase the murmur, just like any other murmur. In Hocm and aortic stenosis, both S4 heart sound is present. Hocm murmur radiates to axilla. Aortic stenosis radiates to carotid. Murmur radiates to carotid. That's a very important point. Then Hocm has the carotid pulse of Hocm is bifid pulse. That is pulses bis feriens. Pulses bisferiens. In aortic stenosis, its pulses tardus. That means slowly the pulse will rise. Slow rising pulse is a feature of aortic stenosis. Pulses tardus. So the points that we missed in this list of S is S4 heart sound plus. So I hope this discussion is helpful. Again repeat, Hocm means, key points to know, it's autosomal dominant, large A wave is seen, apex beat is doubled. The role of B and C is beta myosin and C protein mutation plus beta blocker and calcium channel blocker, which are going to be propranolol and verapamil, are going to be the first line treatment. And then comes the rule of S, small h, systolic BP abnormal, systolic murmur, that is ejectional, squatting reduces the murmur, echo causes, in echo you will see septal wall thickness, septal wall is thick, more than 3 centimeter, and then there is going to be exertional symptoms, syncope, shortness of breath and angina. This exertional symptom is going to cause sudden cardiac death, and S4 heart sound is present. Okay, so there's one more question that we need to know here is the reason for sudden cardiac death is going to be ventricular tachycardia, which is going to be non-sustained VT. So ventricular tachycardia is going to cause sudden cardiac death in Hocm. That's a very important high standard MCQ. So I hope all these questions are helpful for your examination. Thank you.